it's important to create OT awareness in India. And if anyone, I know like there will be many people wanted to jump in, but if anyone wants to come first, it's good before I ask somebody. So I will repeat, it is why it is important to create OT awareness in India. Anyone wants to start? Providing there's a silence, I will start with a little few things to give a hint on, okay? So India is a country with a various diversity, as you all know, and there are many professions in India. So and internationally now, India is being one of those countries who is promoting medical tourism. So if you could know that, there has been having privilege to live in a couple of countries, I would know there are many people who are particularly traveling to India for medical purposes, be it a surgery or be it in advance. You might have heard in the national news, and people have come from Pakistan for specific life-saving intervention in India. So as we are related in an allied medical field, and we need to know like what are the advances that we can do in our profession, and creating that awareness is good. Okay, so now I will make it simple. Please come in for the conversation to say what are the OT awareness activities that you have involved. It could be either in your college, if you are in an educational profession, or it could be either in your own practice that you have created. That should be loads. You have done more. No, I would like somebody to step in and share your experience so that, like, this forum can be. So Karthik.
Okay, so first, I just kind of waited for someone else to start for the previous question. So let me start there, and then I'll continue on with this. So why it is so important to promote awareness? Of course, India is a hugely populated country with, as per the latest data, Suresh may correct me if I'm wrong, 2.6 million people with disabilities and stuff. So we have a huge disability burden, and then OTs in general, given the wide scope of practice we have, I always see them as problem solvers. So there is a lot that can be done in a more creative, innovative way. So if OT is a service that's kind of visible to the population, if they really know what an OT is, or what occupational therapists do, then probably we can actually help the society at large. Because I thought, like, how many caregivers of people with disability are homebound because of their family member being disabled. But if the OTs can help them stay safe and independent, then we can liberate them to join the workforce, thereby contributing to the country's economy. So that, not only at the individual level, we can definitely show progress to the patient and improve their quality of life. But I think if OT becomes a more visible and recognized profession in India, it has larger societal level implication, is what always I believed. So in addition, again, I think, we need to promote awareness because, again, when I started my career as an OT in India, on one side, I see patients with stroke and, the people that I can help with my skill set. On the same building, I'm available as an occupational therapist, but those patients are not getting referred to me. Why? So the provider is in the same building, the patients are in the same building, but there is a lack of connection there. Like, somebody has to refer me, because I cannot just go and like treat the patient without any referral as per the organization's policy. But then why it was not happening? I was wondering, like, hey, here's a patient. Then I went to the consultant, started talking. So my point is, you need to promote awareness among all stakeholders so that everyone knows what an OT is, so that the ultimate beneficiaries, the patients, can get benefited. So these are like some of my perspectives. Definitely there are more. I will let others to add on that. Awareness promotion activities I engage, like, I think from the day I graduated, I'm kind of doing it in some capacity. Like, I've just joined some of the rallies that were organized back then, and then I wrote an awareness booklet, in bilingual booklet. I also like kind of worked on translating the occupational therapy terms, 500 of them in Tamil, and then like try to release it as an ebook. So, and also through whatever the channels that I got, like we are doing, and also IOTTT, that is one of the reasons is to promote the visibility of the profession. So let me stop there so that others can chime in.
Thanks, Karthik, for your thought. And I can see that Shobna ma'am has raised her hand. So I will leave the floor to Shobna ma'am to share her thoughts.
Thanks, Jyoti. Thanks much. And well, pretty much what I thought Karthik has just articulated so many of the points already. First, dive into the first question of yours. Why is it important to create awareness of OT profession in India? Personally, I think if you don't create the awareness, there are people who are doing a job which they think that OT are this is what OT is. And there are so many examples that we could pull in India. Since you have mentioned, obviously India is a well populated, hugely populated, and diversity in India, where people do not wait for someone to give solutions. They jump in, they look for solutions themselves. And in a way, if we don't intervene and if we don't create the awareness what we do, I think professionally we may lose our role, especially country like India. And I think that's one important reason for creating awareness. I mean, initially years ago, we needed to create awareness so that we want to tell the population that we are occupational therapists and we can provide so many solutions or so many interventions or or supports. And right now I think population are maybe not well aware, but it's not the same as years ago. I mean, like when I got graduated, nobody knew what OT is. And now I see people look for OT on internet and they call for, support from OT, which is not too bad. So I think it's more important to create awareness to the population because they should know and we should know what we do so that there is a set barrier between the professionals. This is what an OT is because we come across a lot of clients and their families who have been misguided or who may have a misconcept of OT, or sometimes they think that okay, this is what is OT, I can do it myself. So I feel it is more important in such a way that no, well, we are OT and this is what OT is and this is the awareness. I mean, at least to minimize the quackers. That's one thing. And the second question of you, yes, I have engaged myself since my graduation, even before my graduation. Obviously, there was a reason for it because I would say that it was more selfish. Before we got graduated, we wanted to create awareness, so we engaged in lots of activities from my student life, and until now IOTTT is one of the platform as well. And I also have engaged in WFOT awareness creating activities. And recently, well, not very recently, a few years back, we women occupational therapists in Tamil Nadu gathered together, and we did a flash mob in Chennai, and it was published in newspapers and published in WFOT, and we were also telecasted in some of the national channels. And apart from that, I individually participated in many programs to create OT awareness. So yeah, I think we as a group are passionate OTs, so we keep doing it. Thanks for the questions.
Thank you. I would like to summarize the two from Karthik and Shobna ma'am. And what I'm hearing is, yes, OT profession is a unique and it has our own creativity, and we work towards independence as in a country like with a high population, as we are going to top the world with the population. So it is important to address what are the population needs. So, and like as Karthik rightly said, there's a high number of disabilities, and we as a profession involved in treating people with disabilities and further medical ailments, we need to make ourselves visible among the multidisciplinary team and also the medical profession, and also get the recognition and also improve the workforce, probably in a strategical and in a better way. And what I can hear from Shobra ma'am is to just we need to build a better governance so that take away the assumptions that people might have. This is what the OT is. The OT has many departments and there are many specialties. So we need to bring those evidence, like what is the actual scope of occupational therapy is, and also just we need to be with the par with the other OTs across the globe. And what was I? And it's great to hear the personal experience of women empowerment in occupational therapy, like everyone. And hats off to the woman who is involved in promoting occupational therapy in particularly in Tamil Nadu, doing going with the trend of doing flash mobs and everything, which is really good. Like we need to keep up the trend, we need to change, which is a very good to hear. And thanks to Karthik on his creating his awareness of through the books and everything. I would say like that would be something that we all need to take on as an individual basis, because the change comes from self and it goes beyond. I can see that Kripa wants to share her thoughts, and I will invite Kripa to join it. And also before, if anyone wants to introduce yourself as well, I can see that there are many people who have joined the session, who are regular participants of IOTT. Is certain in chat, and also like if you're new to one, feel free to introduce yourself. And I welcome Kripa to share her thoughts.
Hello, sir. Thank you for the opportunity to share my thoughts. So I'll first start with the first question, like as everybody was talking about. I just wanted to uh, uh, extend what Shobna mom was saying. Like our OT in India is like is being contained to like certain characteristics, like okay, this is what OT is. And also like in order to not diminish our scope to only certain areas of practice, we need to create more awareness. If you Occupational therapy is like becoming more aware in I like there's more awareness in India compared to like a few years back. However, I feel like OT is more towards a particular scope, like pediatrics. People know that we have a huge role in pediatrics. However, our role in neuro, mental health, and orthopedics, and even in the community is very diminished. I think OT awareness should be like more towards other scope as well, other areas of practice as well. And also, as like Karthik sir was saying, to improve the quality of life of people and population in general, and also for the disabled people. Uh, I think our opinion and our strategies would make a huge change in people's life. And I think that has to be acknowledged by all the hospitals, the healthcare centers, and schools or everywhere. And moving to the next question, how I have you know uh, engaged myself to improve the awareness. I've engaged in like awareness talk in my previous work. Like I've given an awareness talk about what is OT, what are the scopes, where we work, and all sorts of things. And also we used to go to during OT day, we used to go to schools and especially like 10th, 11th, 12th students, like who are like looking for different opportunities to move, not just to nursing or being a doctor or dentist. So we kind of like gave awareness talk that, like, there's a profession called OT where you can make a huge difference in people's lives. So I've done that. And also, like, we've again, like, during the OT day, we've given pamphlets to people, like to doctors. Some doctors know about OT, but then, like, maybe you go to a gynecologist or you go to a optometrist or ophthalmologist, like, they won't know. So we've given pamphlets to different doctors so that they know what the OT is and what we do. Yeah, those are some of the things that I've done. Thank you.
Thanks, Kripa. I think actually you have nailed such a way that you have given some answers for my next question, which I'm going to ask about the areas of practice that needs awareness. But I will hold on because I have Molly here wants to share some thoughts. Before I let Moderator speak, I just will summarize that it's good to highlight there are the areas of practice that we need to create awareness. So it's good that we are identifying those things so that we can work on components and also work on a strategical way in improving areas so that so everyone understands the scope. Saying that in 2021, IOTT have developed and published in IJOT about the scope of practice, OT practice in India, which is something good for everyone to know. And I would invite everyone to give a chance when you get a time to read the scope of practice, and which is one of our hard work of IOTT members. And I will take this opportunity to advocate ourselves what we do. And I would like to invite Murli to share some thoughts on the questions that we are discussing at the moment.
Hi, Jyoti. Thank you so much. When it comes to awareness, this has been the first thing everybody talks about from the time when we joined, and it is still there, and it will always be there, creating awareness. And complaining that we don't have awareness will also be there for most of the time, because we are a field where our area of expertise or area of service is so vast. There will always be areas which will still be touching upon. I see this awareness aspect into two different parts. One is the fraternity of people who refer clients to us, our partner rehabilitation professionals, lack of awareness on them, and as well as the awareness part of our own self. When people come to know about occupational therapy, when they know what OTs do for them in the rehabilitation field as a team member, they would obviously refer. I think most of us are kind of hesitant and taking ourselves in the backseat that they should know it themselves. We have to be proactively reaching out to them and tell them that, this is what my job is. I can help you with this. Instead of telling them, like, you're not aware of OT as a profession. And from our end, what happens in the second part is, when we get a chance, that when there is a reference coming and then there is a chance for us to stand up to ourselves and tell about occupational therapy to them or to the world, we lack in two areas there. One is the motivation to talk to them, that willingness to talk to them on our own. And the other part is the skill level. That some of the areas where if we explain properly to them, if it means to, it makes sense to the people, obviously, yes, they will support OT. But when we have less knowledge, not everybody, in some cases, yes. When we lack in that aspect, obviously we lose that edge over people when they understand it. A recent example is, I've been getting some of the references from a very well-known hospital in Chennai. I have no idea who put that thought into their mind that, they have to come to an OT for hand rehab when the person is a spine surgeon, and then there is one ICU expert bringing sensory motor neuropathy affected 13-year-old girl for OT when there is a wasting of muscles in the hand, and he sits and talks. But they have all come to us after that 6 months or years of physio or years of rehabilitation field, and then they come to us. Have I done that on my own to pull them towards me? No. But now it is my responsibility to make sure they understand or they value my profession, because they have come to me and giving them the best I can. These are the two things I feel like, both aspects awareness has to be addressed. My contributions towards
Thank you.
awareness is, sorry.
Yeah, go ahead, Modi.
Just quickly, my contribution towards creating awareness is, I think from the beginning I have always believed in, going out and talking to people and addressing the public in conferences and workshops. So I think I have done somewhere around close to or more than 400 talks towards creating awareness to professionals and the parents or clients as such, including one yesterday where I had addressed the Hemophilia Society of Tamil Nadu on the role of OT in taking care, which they are not aware of. But I have learned in my PG time in Hemophilia Society in Maharashtra and Bombay, we have done that role and they are doing very well. But in Tamil Nadu, uh, my ignorance is I haven't even been aware that there is a society of this sort in Tamil Nadu. So it is on both the sides. They have reached out to me. I have failed in reaching out to them. But I made sure that once I get it, I make use of that opportunity and may advocate for my profession for their benefit.
Thanks, Murali. Thanks for sharing your thought. What I hear is, yes, the creating awareness is going to be our lifelong thing in the profession of OT. Like, there is a question like when you stop learning, and that will be like, no, I will never stop learning. It's similar to that as well. We have to create awareness. We have to spread the awareness as long as we are in practice, as long as the profession is there. So there is a need for this to be ongoing, and also we need to reach out to people. Okay, I'm just going to recall the few conversations that had happened in the previous charts, and there was one discussion saying that yes, in medical profession, in their textbooks, when they learn about all those curriculum and everything, and the aspects of occupational therapy in a medical school books, is only one paragraph. So that's one of the conversations we had in the past. So understanding that, yes, how far we need to stand for ourselves, how far we need to create awareness among the other medical profession, it puts a highlight like, yes, we need to work harder and we need to keep ourselves visible and also promote our activities and every aspects to get there and to reach out to people and to other medical professionals and also the public and patients is key vital. And if we are aware of ourselves and we approach them with confidence, with the knowledge that we share, will enhance this profession. And I have here Gondadan Ramalingam. You want to share your thoughts? Feel free to share your thoughts.
Hi, Jyoti. Thank you for inviting and organizing the chat. Yeah, I recently attended the IOTA conference. I was encouraged by a lot of presentation from Tamil Nadu. Most of them kind of based on the look around the pediatric field. I was kind of, there's a lot of stroke and the adult rehab presentation in mental health are kind of coming from kind of Maharashtra and the northern Delhi. And one of the presentation about the women empowerment, that's from Orissa. That's actually about the ergonomics for the women's in rural Orissa. So that's a quite variety of presentation, but in Tamil Nadu, it's mostly with the pediatrics. I think the awareness, creating awareness in Tamil Nadu, it has to be, I fully agree. I can't agree more with Sovana madam that when we graduated, they don't even know what OT is. Now they have awareness and what it is, and they mightn't have the whole area of our practice among the general population. I have some session. I recently attended a local regional conference. They raised during the COVID, one of the mental health OT was engaged in IFM, the local FM. So she had kind of a series every month or every week, and she had number of series, and there was a lot of demand for it, I think. So as we are doing it here, so some people attend some days, and some might come across some of the chat and the FM. So we could actually utilize the FM and the social media as well. There would be cost-effective methods as well. So I agree with Murli as well that we need to step up and to showcase what we do. So people will be willing to come to us once they know our expertise and our strength, our service to patients. So we just need to step up and do the cost-effective methods like FM and the social media. That's kind of a trend in at the moment, and also the traditional methods like newspaper and TV channels. There should be a kind of, as we do here every quarter, and there should be kind of a series so people know it's coming every last Monday or last Friday of a month, or every Friday or Saturday of a week. So people can tune in, so they don't have to go and look for the schedule or the thing. So it's kind of automatic. If someone has an interest, like for example, as we all know, in the winter time we have an issue with the plumbing and the heating here in Ireland. Like we don't need it in summer, but when we hear something about it in summer, and we straight away go to that particular service when we need them. So we just need to be there on the general population to showcase kind of a streamline, so people when they need it they come to us.
Thanks, Godan, and thanks for sharing your thought and highlighting that the stepping up into the current trend of being in a social media's limelight, which is vital. That's kind of an opportunity for us to enhance and reach larger audiences to create awareness. You have correctly said that, and yes, we need to engage with the other professional social media platform and also news channels so that the awareness is multiplied in multiple times, and that would be great. And I have few stats which I'm going to share in a minute, and thanks for highlighting that. So on this note, I would like to move on to the next question I have, which is like, what are the areas that we need OT awareness in India? As Kirba and also a few other members have said, like, yes, we need to look on the areas of components. Now, what, and I recently had a conversation with a fellow occupational therapist who is involved in academic, and I have realized that yes, back in days, like we most of them had undergraduation, then we started working on the post graduation, and I have heard that there are more opportunities for specialties coming for masters. There are more than 10 specialties coming up, and also recently there's masters on MOT on oncology that have started recently. That tells that yes, the scope of practice with each area is improving, and that is and we need to identify the need and what would be the next area of specialty that we need to work on. So on this note, I would like everyone to share your thoughts. What are the areas that OT needs awareness in India, and making sure it meets the population needs? And I see that Karthik wants to share some thoughts. I invite you to share your thoughts on this, please.
So, Jyoti, before I share my thoughts, I see Jeevashree and Vipuri Aishwarya Venkata joined us today. So before we move on to the next part of this discussion, if they have any preliminary thoughts on, the awareness, promoting awareness about OT in India, I would like to hear from them as well. So if Jeevashree, if you could go first, and then Aishwarya, if you could go next. If you just kind of like take a couple of minutes to introduce who you are and then like share your thoughts, then I will pick back on Jyoti's current question and then share my thoughts. Jeevashree, would you like to go first? Jeevashree, can you hear me? Or Jeevashree? All right, Aishwarya, would you like to talk? Yeah,
Am I audible?
Yes.
Yes, you are. Yes, you are.
Myself, Vipuri Aishwarya Venkata. I'm from Goa Medical College, working in neurosurgery department. So I think there is lack of awareness in our field. Like many people don't know who we are, and some of them know, but they recognize us as a physiotherapist, but not as an occupational therapist.
Yeah, yeah. Thank you. Thank you for sharing the thought. Jiva Sri, would you like to say something? All right. I see Suresh's hand. Suresh, would you want to go first?
Sure, Karthik. Hello, everyone. This is an interesting question from Jyoti, and I must say, before we embark on what aspects we need to look at, something that's very important that we often forget is what goes around all the occupational therapy academics, researchers, and practitioners in India, and even globally. And two key words that we need to dig deep into is misinformation. Misinformation in occupational therapy. That's very important. And the second thing is information asymmetry. I think these two terminologies have to be dug deeper. Primarily, the first terminology from the perspective of we as practitioners or researchers or academicians. Um, who knows about OT? What kind of information is provided to students in India about what we do is very important. And when I look at how OTs explain what they do, it I know in 2003 when I started practicing, I found it difficult, and I see the same kind of difficulty among those who are graduating even today. So what we teach about occupational therapy matters a lot, and it's not creating awareness among others. It's creating awareness amongst our own circle in terms of looking at how best we provide the correct information to those who learn occupational therapy and then practice it for people with disabilities in need. That's one key aspect I would like to stress on, that we need to dig deeper and then work more on it. And the second aspect is information asymmetry, and that is primarily to do with people who receive our service as consumers, and also people who bring us in to look at developing policies, programs, and say any kind of service planning or service improvement activities. Because when we start to look at information asymmetry, an OT might know something, and another OT might know nothing, and another OT might know everything, and we really don't know who is actually selected to come into picture to address the needs of the society in India. We talk a lot about Maharashtra, and we always have seen people from Maharashtra contribute. However, the information asymmetry that we need to understand here is um, who is there on the board in All India OT Association, for example, who is there in some of the programs that's been run nationally, who refers to people other than people from Maharashtra, and how many people are actually having. So, for example, if you look at how many schools are there in Maharashtra for OT compared to schools in Assam or northeastern countries, states, you can obviously say that that is one reason. So when students study, they know what is happening and they attend conferences, they present in conferences. What if there's no school in a state? How do we look at promoting awareness about this? Does it mean that Maharashtra know OT more and Assam does not know OT at all? So that's information asymmetry that I'm talking about. So I think both these have to be very clearly looked at, and the information asymmetry, particularly from policymakers and decision makers involved in uh, including rehabilitation and social care within country or in any state, they have to be provided with lots of information which are very clear, specific, and accurate. Thanks, Karthik and Jyoti.
And thanks, Suresh, for highlighting that. Yes, we need to give the right information to the right people, and also we need to be confident enough to say like any inequities should be addressed in a right and in a professional way. And probably we have also discussed the need for evidence-based practice, and that would be something to go on. Just to touch on the stats that you mentioned about the OT, I have did a little bit of research in and giving some numbers, and if I, it might not be accurate, accurate, but it could be almost approx. So there are over 50 colleges in for occupational therapy in India, and among them, like 15 are from Tamil Nadu, with one central board college, and then 2 state board colleges, and then the 5 are deemed universities, and the rest 8, including the CMC, are all like under Dr. MGR University. So saying that like 15 are from Tamil Nadu, like that tells like the 1/4 of the colleges are from, that is a high need for us to identify this. Yes, it also tells that there is a gap. Okay, so the many states in India, so and we have a total of 50, so that is a discrepancy in numbers. And but probably like we being a strong representative of occupational therapy in India, we need to address those inequalities, and we need to take every chances. And if we have a fellow occupational therapy working in a different states or country, we need to take that board and to address these inequalities and make sure that we are the spokesperson for occupational therapy in that profession. And also saying that creating awareness, IOTT has created definition for occupational therapy in English, Hindi, and Tamil. And I would say these definition has to go to large languages, as India being a country that speaks more than 200 dialects, and there are more than official languages. Our goal should be this definition has to translate it into all the official languages in India, and we need to ensure that that the people speak their native language should know what is the definition of occupational therapy in their own native language. That will be one key part of creating this awareness. I see Murali, Krishnan, and Karthik wants to share their thoughts. So do you want to go, Karthik, first, and then Murali, as Karthik raised his hand first?
Okay, but yeah, I just kind of like pull it down and put it back. But Murali, if you kindly allow me to go first. Again, I literally just want to underscore what Suresh said as well. But again, when it really comes to identifying the areas, like to address your current question for discussion, I think one of my latest workforce survey that we did in India, like 72% of the practitioners work in pediatrics, followed by a good chunk in neuro. And then just kind of the numbers are dwindling to single digits after that in all other practice areas, with geriatrics as 1%. But geriatrics is such a huge, practice area in other parts of the world. Again, we need to really think about all these factors, like cultural factors, language, multilingual country here, and also like, all these colleges are like housed in Maharashtra and Tamil Nadu. Like there are pockets where a lot of other areas do not have OT institutions, thereby number of OTs practicing in that area. So we really need to look at all levels. And also when it comes to advocacy, like, Kriba said, like, awareness promotion through speeches and talking to students and stuff. Like when I when I started my own practice, I went to the school, I graduated, with my 12th grade, Ramakrishnan mission in Tinagar. I just went there and then delivered a session, because those are the students. After that, they are going to find their own career. So we need to like kind of really tell them. So we need to put ourselves in career fair, go to like schools and talking to these, 11th and 12th graders about our profession, and then like what is the scope of this career. In general, I mean, again, I can go on and on about this topic, because again, like as Murali said, we have hundreds and hundreds of awareness promotion initiatives behind our belt, and let's not list it here. But the bottom line is we need to like do it in multiple levels. We need to do political advocacy, grassroots advocacy, and then, we need to promote awareness through research. We need to educate the stakeholders. We need to collaborate with others, sheerly increasing the number of OTs in the country, because like more OTs are there, then they all need to find their job in some spaces, and the workforce around them. So when I went to one of the hospitals in Chennai as an occupational therapist, they didn't know a term called occupational therapy or occupational therapist before my presence. But when I came out after 2 years, at least the workforce in that hospital, all the nurses, all the PTs, all the doctors, they come to know. So my point is merely increasing the presence of OT will also kind of increase it. And one important aspect that I want to highlight, like it's already been discussed as well, in the Western world, when a student goes to clinical field work like internship, one of the evaluation criteria is that were they able to clearly articulate what occupational therapy is? Not the official definition, but in their own terms. But they need to have some sort of a clarity in order to explain to the patient what an OT is, what OT is, and what an OT does. So I think we need to kind of think at the level. So when we release the students into the community as entry-level practitioners, we need to prepare them to articulate OT better. Then they will be also like be the mouthpiece of OT to, further spread awareness. So, again, in terms of areas, I would say, as I said, pediatrics and next neuro is somewhat there, but still it's not across the country. Pediatrics is the most popular practice area at this time. So in terms of area, I think we need to like target all the other practice areas other than pediatrics, and then like even neuro, there are pockets. So it needs to be, spread awareness about it as well. And one final thought I want to leave before I leave it to Murali is, instead of like thinking in terms of practice areas, I think we need to change our lens. What are the needs of people with health issues and disabilities in India that OT can address? So we need to go on a needs-based perspective rather than, okay, these are the practice areas. I can do this in this practice area. I mean, that's one way to do it. But I think once we start addressing the needs of the people, needs of the society, then the people will recognize the need for us, and that will help the profession, like, progress forward more quickly than the other approach. Thank you.
Karthik, and that's great to know your research that it's 72% of people in the area of pediatric. It's massive. So yeah, that appears that yes, the balance is not right. So yes, we are focusing on one particular area, but there is a scope of practice elsewhere. Like to become the part to the rest of the world, I can say there is a huge area that OTs needs to expand their, particularly geriatrics, which is coming up. And it's good to know that there's oncology is one of those master's degree recognized, but we need to also find, and as also Suresh said, that is a huge area that we need to improve more on the research and development. And because research would be one of those keys that our publication can go to the multiple aspects of other health professionals and also across the researchers and pave way for innovation. And Murli, I didn't forget you. If you want to share your thoughts now, please join us.
Hi. Yeah. Before going into my point, I wanted to say, like what a choice of word, or what a word, what a impactful word Suresh has mentioned. Uh, it summarizes the whole aspect of it, and from then onwards. Now, what is the area which I would like to see the awareness to be created more, or the whole OT clan to be focused more on, is, as Karthik clearly mentioned and given me a way out in this, what is the need of the people? Where do we address the main component for the society and community on the whole is their participation and their independence. So community level wise, I feel the community ergonomics aspect, where setting up buildings, designing buildings, and making people independent in their homes and their work areas. So as an occupational therapist, we take up that ergonomic concept a little bit more seriously and get involved and create awareness in that aspect. I think that will become a major area of people letting everybody know, because even people who are not in direct service aspect of occupational therapy will definitely get the idea of what OTs do when it comes to seeing what we have done for the offices or the buildings or for the government or the society in general. So I would say the ergonomics aspects, which actually directly addresses the society in general, will be the right thing, because that will advocate on its own for the people about the occupational therapy. And I would like to share something very funny here in my point is, recently my daughter was asking me, because the teachers were asking the students to tell what their father and mother do. So she was asking me, like, what do you do? Who are you? So what is your job? And I told her, like, I'm Dr. Krishnan, an occupational therapist. And then she's like, I know that, but you tell me what you do, because my teacher asked me to tell exactly what exactly you do. So then I have to explain her how I help children with needs, how I make people independent in their life and help people live their life in the community. So I hope she understood everything I said. But what she understood, I help people who will not be able to do their own work. That's what she ended up saying in the school. Uh, just out of the box, I thought that also makes sense. Yeah.
Jyoti, you're on mute, Jyoti. Sorry.
Sorry. Thanks, Murali. I would like to touch on the last point you mentioned. Yes, we need to communicate to in a language that everyone understands, and that would be the best way to reach out, right from no matter what age they are or what background they are from. We should be able to communicate to them such that they understand. And that's the key thing that you have highlighted as well, along with other thoughts. And I see here, Professor Shobna ma'am wants to share her thoughts. Ma'am, please join.
Thank you, Jyoti. I've been hearing the previous speakers' conversations, and I'm absolutely agree to all their views. And I just would like to add on, a certain point. I mean, we OT. I think at some time we would restrict our services to population with disabilities or population with need basis. However, what I understand and what I realize is OT is for everyone. And if we as OT begin promoting occupational therapy for all population, no matter whether they have disabilities, whether they have problems, because ultimately our core concept is in enhance participation, improve independency, which in a way it applies to the general population too. I mean, we wouldn't disagree if we say that if I have a back pain, I would like to take a physiotherapy intervention. For that, I don't need a disability, which is probably that restricts my movement, that restricts my participation. So we actually don't go to an OT in a way. Well, I have back pain and I go to physio, but I don't see beyond that the back pain affects my participation. It prevents me to do my normal day-to-day activities. Until it becomes a disability, I have no idea about what OT is doing, you know. So put the scenario in all aspects, like no matter whether it's pediatrics or geriatrics or oncology. um, I would say that from 0 to 100, whatever the population, the age, and the health, physically or mentally or emotionally, more than we as a pediatric OT, more than the support that I give to the children, I tend to give to the families, the especially the mothers who are the primary carers. They don't have the disabilities, but I watch that if I take care of them, the children grow better, and I see the progression on the children positive. If I consider the family as a whole. So I think in a way that OT should, think beyond disability, think beyond conditions, and of course, we do still need to develop so much in the other, apart from the pediatrics, the other areas. However, if we think globally, I think it will be really good. Thank you so much.
Thanks, Shobham. I'm sharing your thoughts, and like yes, that gives a idea of how holistic we should be, and also how broader our scope should be. Yes, yes, as you said, like yes, we do have service here in Ireland, which will say like no, we used to say from birth to grave. That means like from a child is born until somebody is going towards their grave. So there is a scope for every practice to do. That's really resonate your thoughts. Yes, the scope is larger, and each one will have a need. And then OT with the creativity and also making them independent, we have a role in every aspects of life. We need to use our creativity and also use our innovation and use this best modalities to serve the right people at the right time with the right treatment. And I see here Suresh wants to add on this. Suresh, do you want to go ahead?
Yes, Jyoti, thank you. So I just liked both the inputs from Shobna ma'am as well as from Murli. To start off with, Shobna ma'am, she's trying to say that we need to understand, we as OTs need to understand disability as a whole, which links to what we need to learn or what we need to be aware of in terms of disability. So I think most of the OTs in India look at disability as impairments. However, they should move away from that concept of disability is equal to impairments to the international classification of functioning model, where we look at disability as an umbrella term, which includes impairments, activity restrictions, and participation issues. And it also highlights the need for looking at both social and psychosocial environment into picture, and then look at disability as a public health issue rather than disability as an impairment. And moving on from there, if we as OTs look at disability from how Shobna ma'am asks us to do, if we move to Murli's feedback on the ergonomics part of it, okay, he was targeting going to individuals and then saying that we have a role to play in ergonomics. However, if you understand the way in which Shobna ma'am was suggesting to understand disability, then we might not go to Murli's individual perspective. However, use that aspect and move out to see we have an Accessible India campaign for the past 7 years, right? Which means all the government buildings, all the buildings or the built environment in the country has to be disabled friendly. So looking at an individual and then promoting awareness about us and our role in ergonomics, compared to moving to the government officials and then saying, see, you have an Accessible India campaign for the past 5 years. How have you actually used occupational therapists to look at how disabled friendly is your country with in terms of built environment? So that's one perspective of looking at things. The other interesting information that Murli shared was about the school concept. I would say we can also look at promoting awareness in school. So the same situation happened to me, not in India, but here in the UK. And it's not about what we do or showing them what we do. It's about helping children in nurseries, and at the level of nursery, because my little one goes to nursery, so I have to go there and then do something called show and tell. And so I went there. I asked the children to actually try buttoning without the use of thumb, and I asked the children to try and wear their jackets with one hand, and they had a brilliant experience. After doing that, I just said, do you know who helps them? And I told them the importance of occupational therapists, and occupational therapists help them to do this. And then I trained them to do it on their own, which the kids enjoyed and the teacher themselves enjoyed. So there's still the same opportunity for us to take it to the community and then say who we are. And also it's responsibility of every OTs in India as well as abroad, if they're really bothered about increasing awareness, to go to the policymakers as well to tell them we are there and we are the people who are supposed to be professionally qualified to do what they are trying to implement as Accessible India campaign, for example. Thanks, Jyoti.
And thank you, Suresh. That's a great that you have dealt that in a school level and promoting the aspects of and also demonstrating the aspects of occupational therapy and practice in a way that they can understand. That also gives me refreshes my memory that back in my days, like we have gone to community rehab, and then we used to do some role plays in the community to show them what is the aspects of OTs and how to promote the awareness among the people who are not so literate, and to make them understand in a way of play and in the medium they understand. And yes, so we need to mold our approach and also say it in a way that everyone understand, and also to reach everyone in the aspect they do. And I would like to move on. I think we have discussed a lot on the areas that needs, but generally what I'm understanding is, yes, we need to focus on all the areas to create awareness. And I'm conscious of the time, as we also, there's two more questions that we want to dwell in. And I would like to move on to the next question that we have. What are the factors that do you think that are negatively affecting our professions? Yes, it could be even like misinformation, like, so most of us like might be understood like physiotherapy, but there's a broad scope of practice difference between physiotherapy and occupational therapy. And like I would leave it for the floor to discuss what are the factors that are affecting negatively on our profession and how we can overcome that. What would be the best approach? Um, you might start with your own personal experience that you might have come across, what it has affected negatively. And also, like, I'm just touching on the Karthik said, when he went into an acute hospital, they didn't know what a OT is. So that, yes, that tells, okay, how somebody will be taken away when you're a new starter. If you're going into a hospital, if they don't know, yes, you have to scratch and say, like, okay, how I am going to get started, and how I am going to make myself recognized, and also make the profession visible. That's a lot to take on. That I would see is, yes, we need more awareness on that. Does anyone want to share how this is affecting negatively in our profession at this age?
So let me go first. So, I think that the term itself, like occupational therapy, and for a long time, it was translated in Tamil as Tholil Vali Sigichai, Tholil Vali Marthum. So that was itself like, they just took the literal translation of the word occupation rather than the contextual, the use of that word in the context of occupational therapy. So the terminology is the first factor in my humble view. And then the second thing is, like, again, if you go and say, I'm a surgeon, people know what a surgeon does. If they go and say, I'm a physician, they know what a physician does. So, like, but just by the name of that field itself, the general public, the mass public have some sort of a overarching awareness about like what that person might do if they're a policeman, for any other, non-healthcare field as well. But then when it really comes to occupational therapy, like, the first time I introduced myself as an OT to one of the healthcare people is, oh, do you work for, work in employment exchange? That was the response to me. So that's one thing. And the second thing is, again, our scope is very broad. And as we already discussed, a lot of people have trouble explaining in a very simple term. You cannot go and read the Petriti's book definition, by introducing what is occupational therapy. You need to really like break it down to the person on the other end, and then help them understand what OT is. So that there is a little bit of struggle there, where our own, we need to reflect on ourselves. How many of us are able to clearly articulate what an OT is, to a layman? And that is why, like, from IOTTT, we took the initiative of drafting that layman definition, and then like going through the process of, establishing it through public comments and everything. So the bottom line is, the field is so broad, and also there is some sort of a difficulty in explaining that to layman. And then to complicate that, in the context of India, we have 22 regional languages, so there is language barrier. So if a person can really like say that in one language, and if I just gonna go across the border, I can either talk in English or Tamil, but then if I go to a different state where a layman could not speak both of these language, how am I going to help that person understand? So again, the cultural context, the multilingual context of India makes it a little bit more challenging in the context of India. But in general, our scope is too wide. But it's a great philosophy. We have a strong philosophy, like similar what Suresh has explained, like he went to that community level and then like kind of tried to help them understand through experience. We need to do more of that. And again, it definitely it is not enough that one person in one corner of the country is doing all these things, or in some places. We need to motivate the students and give these examples to the students and have them do in their own practice setting in their own community. So that's how we need to reach the grassroots. So I mean, again, we have a lot on our plate to do, to go there. We have a long way to go, is my thought. Thank you.
Thanks, Karthik. And also, I would say, we need to address, as Suresh already said, like misinformation and also information asymmetry. We need to understand that. So yes, we should have that confidence, no matter what. It could be a consultant, or it could be a doctor, or even the director of a hospital. If yes, there is a misinformation, we should be confident enough to say, like, yes, this is what our scope, and this is the. And also in the previous Saturday night chat, we also discussed a lot about boundaries, crossing the boundaries, or making sure there's more of interdisciplinary practice, which I think that is negatively affecting our profession. So yes, whenever there is a practice that's been delivered, OT practice delivered by a non-registered practitioner, yes, we need to be making sure that we address it in a professional way, and also to stand for our rights, and also very clearly promote the profession in a practiced, which is practiced under the proper governance, and as a individual, and also as an association, and also as fellow colleagues, we need to stand together to address those inequalities and also malpractice, which is if a practitioner who is not registered, and if you're delivering an OT, and if it's perceived in a different way, that will hugely affect the profession in a negative way, and that we need to understand. And also, I need to highlight that in the countries advanced countries where the practice is well established, they do have a professional supervision, and also the registration body has a periodic review to see how their practice is, and how each OTs are keeping up with their profession, continuing their practice, how they're refreshing their knowledge. In a country like India, where yes, there is a registration body, but I can't, I'm not actively practicing. I don't know what it is, but still, from as an outsider, what I see is the frequency of supervision, or the criteria for registration validation, and it's on in a different aspect, which we have a broad areas to move on. But as an individual, we need to take that own self-initiative to see how the better parts of the world is doing, and keep up to those by attending the conference, refreshing your ideas, talking to peers, and also joining the like-minded people to enhance your knowledge. And we'll make sure that we can take away all those negativities for our profession. And I see that Sobra ma'am wants to share her thoughts, and also Suresh. They did put a hands down, but
Suresh,
I will
would
invite
you
you
like
to.
to go first, Suresh? I don't mind.
Sure, ma'am. So I just want to not disagree, but kind of look at a different way of what Karthik mentioned, and absolutely Jyoti pulled that into his conversation, which was perfect. What I would like to say in terms of barrier is, number one, if you look at the example of COVID-19, and when people were told to do something, to move from one street to another street, the whole country did it, isn't it? So the same thing can be done if the government says, this is occupational therapy, go get occupational therapy services. So I think the barrier to the question you asked, Jyoti, is lack of recognition and lack more than recognition, lack of awareness about occupational therapy among those who are involved in provision and management of health of the nation. And I think that's the biggest barrier that we have. And on the other hand, if you look at the scenario that Karthik mentioned, if I have a disability, or if my family members have a disability, it all depends on how much money I have. And so, and it also depends on who is available for me. And so I've met people in the community saying them that you need occupational therapy to get back to your normal activities of daily living. However, the question there is, okay, where are they? And how much will they ask? So the issue again goes back to the responsibility of the system that we have in India, which does not protect people to get back to their normal activities of daily living, unlike how it happens in Ireland or in Australia or in the US. And it also does not provide a way out. If I am a politician, I can come up with a national program, and that's how we have this diabetes program at the minute. So they did screening at the parliamentary entrance. Somebody who's a member of parliament had diabetes, and immediately we had a national program for diabetes. And if you go a little further, you can also see that the national program is not restricted only to diabetes. It's called NPCDCS, which means C stands for cancer, D stands for diabetes, another C stands for something else, and another S stands for
Cardio.
stroke. Yeah, maybe cardiovascular disease. You're right, Jyoti. So we have four conditions because four conditions were found important by those people who can go and talk about it in the parliament. And if you look at implementation of these national programs for the past 20 years, we didn't have a single report related to how many people are disabled because of stroke or cancer or cardiovascular diseases. So I think the real barrier is to tap on and then speak for ourselves and advocate about our profession amongst the decision makers in the country, rather than going to the public, because public knows they need us. The only thing that restricts them to have us is either money or the availability of us in that place. Thanks, Jyoti.
You
So
nailed it,
real quick, let me
Suresh. And
Yeah, I'll take 30 seconds to respond to Suresh. So Suresh, I totally agree with all, with everything you said, but I think, in my view, I think we need to be like multi-pronged approach. Lack of accessibility to services need to be addressed, system level things should be addressed, and political advocacy needs to be done. At the same time, we also need to go to the community because the end user need to value our services. They should perceive some value in our services. So it needs to be a multi-pronged approach. But wonderful points. Lack of regulation is another big issue that needs to be addressed. So there are some good topics emerge for future Saturday night chat sessions here. Thank you.
okay, Shobra ma'am, do you want to join and share your thoughts?
Yeah. So quickly, I mean, there's not nothing much that I could add because Suresh and Karthik and yourself, Jyoti, have covered a lot on this particular question. Just maybe to add a bit more, the question that you invited to discuss is: are there any factors that negatively affect the profession, which popped in my mind is we ourselves are one of the major factors affecting our own profession. We, in the sense, what I would like to say here is, sometimes the unwillingness of learning or engaging ourselves in continuous professional development or engaging in discussions like this, if we restrict ourselves questioning the policymakers, if we don't engage in politics, if we don't engage in the association, so these are the factors do actually have a great impact, a negative impact, definitely affecting our development, OT profession in India. That's all I really would like to. I mean, we could elaborate this, maybe in the future topics, but I guess you get the point. Thank you.
Thanks. Thanks, Shobra ma'am. I think you really highlighted on the self-awareness and also the code of conduct that each and occupational therapist has to be. Because yes, in a few other organizations, we do have a code of practice and how occupational therapists should carry forward. Like what we have for etiquette for any meeting, like be respect to other your fellow members and also also follow the ground rules, and that is the baseline. You really touched on that. We shouldn't be forgetting the baseline. We should be carrying ourselves in a professional way and keeping up the code of practice, and also not to limit our learning. Okay, our learning has to be ongoing, and a profession like ourselves, like we should continuously develop our skills and keep up to the advanced trends. As Karthik also said, like when we learned there was not some aspect in our syllabus at all. Like now the advance has happened, and so we need to keep up to the trend and improve our skills to the current trend of practice. And I know we are ending towards the end of the session, and quickly before we wrap up, I would like to add on any thoughts that you have, the strategies that can be used to facilitate awareness in our profession. If anyone wants to clearly touch on the strategies which will help to highlight the awareness in our profession. Godandan has highlighted in his previous talk about how we can engage with social media like this. Like if there's any strategies that has missed, please feel free to add on to this, and then we will wrap up the session. I will summarize before the wrapping up as well. Godandan, you raised your hand. You want to join?
Yeah, yes, Jyoti. Yeah, so just to highlight the point I made about the social media, the Aorta conference I attended last week didn't have actually the Twitter like a hashtag for the social media. I was looking on all the social media, like I attended the UK one and Ireland and some of the international ones. They all have the hashtag, like even the basic one, like a simple one, like a IOTA 2024, would have facilitated the network and also highlight so it could have trended in the country because there was 1,500, there was a virtual participants, and that's something we could even at the basic level or even national level or state level, we could have a hashtag for the social media so we can all send a feed and that can be linked up and it can be trending in the public.
Thanks, Godandan, for highlighting. Yes, we need
Thank
to.
you.
I'm saying that from the start. We need to keep up to the trend, and we need to use all the advanced technologies and all the social platforms there. Yes, just to say that IOTT have a Twitter handle, and also we are on the Facebook. We have a website launched in 1st of May 2023, and yes, being an voluntary organization, we have come this far, and also we tried to lead by example. We tried to enhance whatever ways we can, and also just to reiterate the fact that we started our discussion in 2021 about registering, and now since 2022 we are the registered body of societies in Tamil Nadu under the Act of 1975. So these are the strategies that we can show the larger community what are the things that you can do. Yes, keep up with the social media, use your strategies to promote. And as we started with the session today, I asked us a question that yes, 27th of October is considered the World OT Day, and it was declared by WFOT. And we need to know some factors, so like when it started, like since 2010, like we are celebrating 27th of October at Occupational Therapy Day. And there are many strategies that we can use. In some countries, like, the OT month is celebrated the whole month of April, from the 1st of April to the end of April. So they do more activities. So yes, a month is dedicated for creating awareness, and also there is a larger scope for any schools or colleges to celebrate, and that will be a better aspect to reach out to all the patients to know about occupational therapy. And also in NHS, one of the OT week is celebrated from the first week of November. So they create awareness. These are the strategies that we can use. And yes, WFOT is promoting those things, and they have official logo, and everyone at this age have a social media channel. So as being a profession, we need to spread those awareness and let's whoever is joined us today, let's take as a personal motive to share those things to create the awareness of our profession. And I see hands from Suresh, Karthik, and Shobna ma'am. Do you want to go take turns? I see Suresh first, so Suresh.
Thanks, Jyoti. Very quickly, I think one of the best strategy is to convert the unconverted within our profession, who are the decision makers of occupational therapy in the country and academicians. So people who teach occupational therapy and the management of education of occupational therapy, as well as people who maintain academic standards or look at developing the profession as an association at the national level or at the state level, should try and start looking at doing the right thing, avoiding misinformation, and making sure there's no information asymmetry. That's the strategy I think might work. And I would also say, being a part of IOTTT, I would say it is our responsibility to start looking at this at a very serious level, rather than just thinking that it might happen and doing whatever we can do. I think it's for us to now step a little forward with the gear at the advanced level, and then move towards activist mode and then advocate for these decision makers for occupational therapy in the country and academicians to move forward and promote awareness of OT in India. Thanks.
Thank you, Suresh. And Karthik, do you want to?
Yeah, just
Few
real
words?
quickly again, I know we already well past the time. So first, I want to, personally on behalf of IOTT, there are many awareness promotion activities going across the country, especially around the time of that World OT Day in India. Like it's, like I always see the reports being posted on social media and stuff. So people are really doing whatever they can within their local community. So I want to acknowledge that as well as thank them for doing whatever they do. But I just want to take that one step forward is that, again, we don't have to list the strategies because there are plenty, and also always there are some more innovative strategies with all the emergence of media and social media. So we can continue to identify innovative strategies to promote the profession. But one thing I want to say is that, just have some sort of an outcome metrics, try to be strategic. Say, for example, okay, I just kind of gave this article, I did this rally, that's it. Like, my point is, what was the outcome of that? Just try to have some metric. Did it increase the number of admissions in OT schools? And, did it increase? Try to, again, it's very hard to come up with that metrics, but if you have some objective metrics, then we know what strategy works, what don't, and then we can try to put our effort more on the strategies that work. In fact, deliver the results. So that's my 2 cents I want to add here. Thank you.
Thank you, Karthik. And yes, we had lots of thoughts and lots of ideas that we have shared, and also we got some few topics for the next Saturday night chats. I know, the rest of the year topics are decided, but we will have new topics for 2025. Yes, I wanted to highlight there are 4 pillars of occupational therapy that needs recognition, and also that's the scope that we need to build on. One is the professional practice, and all the second one is the facilitation of education, and further on that, and leadership, which is being one of those pillars, and research and development. Yes, we have to work on all these areas, like building the professional practice that everyone has the contribution to do, facilitating the education that all the academics and the colleges has to do. Yes, I'm hearing some good news that yes, in following the physiotherapy, we are also working on going on the competency-based curriculum in the system. That needs to go way far. So build the best syllabus for the future generation to learn occupational therapy and to keep in advance. And also each and every occupational therapist should be the leader of the profession, and they should be the spokesperson for the profession to speak up and do the right thing, and also make sure that you lead the profession with the correct knowledge and also the best practice. Likely, as a few of us are involved in the research and development, this is the area that the OT professions to go way longer, and we need to encourage those people who are engaged in research and development, and particularly there should be a call out for more people to do a doctorate in occupational therapy, so that research strategies will go the path to the next level. I'd like to summarize the conversation today. not in any order. Okay, so yes, we have discussed a few needs of creating awareness, and it has to be a lifelong, and look at any avenues like doing promoting the conversation to leaflets and meeting with the fellow colleagues and doctors, and to make sure that the profession is well represented, and also use any recent trend strategies like flash mobs and giving an interview in a radio or TV channels, or advertisements in newspaper, giving articles or writing articles, and in social media. And we also discussed on advocacy, more advocacy at the every root levels, like politics, and also building a better governance, and building up advocacy in educational institution. Like if you're in a college, like go to the senior management and build up the reputation of advocacy for the college standards, and adding on more specialties, and speaking to all the doctors to create a role for that. Like what Murali said, like hemophilia, when I worked in CMC, we did have a lot of areas for working with the consultant in hemophilia, and also doing developmental pediatrics, and there's a lot of scope. So each of us should be an advocate and create this advocacy, and also reach this to a administration level in council. And also, we also talked about recognition, increasing the recognition among all aspects, and our profession should go on a need-based. Okay, and in Ireland particularly, we are working on a reform, which is we are strategically planning the service needs based on the population needs, and also depending upon the disability rates, and also other criteria, could be language barriers, and also so yes, the profession should be working on a need base to know what is our service users or consumers are expecting from us, by doing an outcome measures and learning in aspects. And again, also, we had a good conversation on engaging ourselves with a good code of practice, and improving ourselves in the aspects that we do, and promoting our discipline in a better way. Okay, so I would like to wrap up that today we had lots of thoughts, and we had new members joining our Saturday session today, and I thank everyone. And before I say the final note, I will want to leave it to Karthik Mani to give a last few words on this as well. And like if you're new to the session today, follow IOTT T for our works that we do. We have a website iottt.org, and also join us for our one of the Saturday night sessions. The next Saturday night session is in April, and we will also publish that in our website, so you can follow us on that. And personally, I thank one and all for your time. I know we just went over the time, and thank everyone for your patience and giving me the opportunity to moderate the session today. Karthik, over to you.
Thank you, Jothikumar. Wonderful moderation. Thank you for guiding us through this discussion today. Just a quick thing, like typically our regular Saturday chat session will be in April, but we are planning to bring in a scholarly speaker from Australia. We are still working on it, so just to accommodate the schedule, it could be early in March itself. We'll keep you all posted. Thanks for everyone who joined us today and contributed to the discussion. And already Jyoti said about all our platforms. Please follow us and continue to support us. Thank you wherever you are. Have a great rest of the day. Bye-bye.
Bye. Thank you so much.
Bye,
Bye-bye.
everyone. Thank you.
Thank you, guys. Bye now.